This is today's listener question. I took 7,000 IU of vitamin D every day for 3 months. My level went from 33 to 34. Does that mean I need to keep taking this much just to stay in the green? She took nearly double the safe upper limit every day for 3 months, and her number moved by 1 point. So, what is going on, and does she need to keep doing this? Welcome to HealthLoom, where we untangle the evidence so you don't have to. This question gets at something bigger than just one person's lab result. The answer depends on why vitamin D advice has changed so much in the last decade, what the biggest experiments actually found, and why her body basically shrugged at a very large dose. By the end, you should have a clear picture of what happened and what she should do next. Let's start with why vitamin D became such a big deal in the first place. For a while, vitamin D was everywhere. Doctors were checking it constantly. People were being told their levels were too low. Supplement doses kept climbing. 2,000, 5,000, even 10,000 IU per day. And a lot of people were trying to push their blood levels to 40, 50, even 60. Then, more recently, some doctors started saying, actually, we don't need to measure this routinely. So what happened? The rise of vitamin D made perfect sense at first. Vitamin D is clearly important for bones. Severe deficiency causes real disease, rickets in children, and a softening of the bones in adults called osteomalacia. And vitamin D has receptors, basically little docking stations, in many parts of the body beyond bone, including immune cells, blood vessels, and the cells that make insulin. That made researchers wonder whether vitamin D might affect much more than just the skeleton. Then came a wave of studies that watched large groups of people over time. These are called observational studies. Researchers do not give anyone a pill, they just track what happens. And in study after study, people with lower vitamin D levels had worse health, more broken bones, more falls, more infections, more diabetes, more heart disease, more depression, more cancer. That was the spark. But here is the problem. These kinds of studies can show that two things happen together. They cannot always prove that one caused the other. Low vitamin D can actually cause some problems, especially bone problems. But it can also just be a sign that something else is going on. People with low vitamin D tend to spend less time outdoors, exercise less, weigh more, and have more chronic illness. So the low vitamin D might be part of the problem, or it might just be a smoke alarm going off because of something else entirely. Then came the testing era. In 2011, the Endocrine Society, a major medical organization, published a guideline that gave doctors a simple framework. Below 20 was called deficient, 21 to 29 was called insufficient, and 30 or above was called sufficient. That framework was easy to use, and it pushed doctors toward a familiar pattern. Check the number, label it, supplement until it goes up. So vitamin D started to feel like cholesterol or thyroid hormone. Check the lab, find the number, label it low, normal, or good. Supplement until it rises. For people with real deficiency, weak bones, gut problems that block absorption, kidney disease, or certain medication risks, that approach can still make sense. But for healthy people without symptoms, a harder question came up. Does checking and treating this number actually make people healthier? That is where the story shifted. When researchers ran large, carefully designed experiments, studies where thousands of people were randomly assigned to take either vitamin D or a fake pill, so you could see if the vitamin D actually made a difference. The big hoped-for benefits mostly did not show up. Let me walk you through the major ones. The single most important vitamin D experiment is called VITAL. It stands for the Vitamin D and Omega-3 trial. More than 25,000 U.S. adults, men 50 and older, women 55 and older, were randomly assigned to take either 2,000 IU of vitamin D3 every day or a fake pill. Researchers followed them for about 5.5 years. The two main questions were, does vitamin D prevent heart attacks and strokes, and does it prevent cancer? The answer to both was no. The people taking vitamin D had almost the exact same rates of heart disease and cancer as the people taking the fake pill. Vitamin D did not move the needle on either one. Now, that sounds like a complete miss. But when researchers dug into the details, looking at questions they had planned to examine from the start, the picture got more interesting. And I want to be careful here because a lot of vitamin D content online highlights these secondary findings without mentioning that the main results showed no benefit. Here is where a signal did show up: dying from cancer. Vitamin D did not reduce the chance of being diagnosed with cancer, but in a secondary analysis, especially after the researchers removed the first 2 years of data, on the logic that vitamin D would not help cancers that were already growing when the study started. The vitamin D group had about 25% fewer cancer deaths than the fake pill group. That finding lines up with a separate analysis that combined results from many experiments, something called a meta-analysis, which gives you a bigger, clearer picture than any single study. That 2019 analysis, published in the journal Annals of Oncology, pooled over 75,000 people from multiple experiments and found that vitamin D was linked to a 13% lower chance of dying from cancer. Again, not getting cancer, but dying from it. The idea is that vitamin D may help the body fight cancer once it starts, possibly by helping cells mature normally and by supporting the immune system. One important catch: in VITAL, this cancer benefit was strongest in people at a healthy weight and disappeared in people with overweight or obesity. So body size may change how well vitamin D works here. One of the most interesting VITAL findings was about autoimmune diseases, conditions where the immune system attacks the body's own tissues like rheumatoid arthritis, lupus, or psoriasis. During the trial, the people taking vitamin D developed about 22% fewer confirmed autoimmune diseases than the fake pill group, 123 cases versus 155. That is a meaningful drop. The effects seemed to get stronger the longer people took vitamin D, which is what you would expect from a real biological effect rather than random chance. But when researchers kept watching the participants for 2 more years after the trial ended, and everyone stopped taking the supplements, the vitamin D benefit appeared to fade. Interestingly, the omega-3 fatty acid benefit seemed to hold up better. So the autoimmune finding is promising, but not settled. It suggests that ongoing vitamin D supplementation may help reduce autoimmune disease risk, but the protection may not last once you stop. On the flip side, VITAL also tested whether vitamin D prevents depression. It did not. People taking 2,000 IU per day had the same rates of depression and the same mood scores as people taking the fake pill. That was a clear no. And a separate analysis of the VITAL data, published in the New England Journal of Medicine in 2022, found that vitamin D did not prevent broken bones in these generally healthy older adults. Most of the people in the study already had enough vitamin D in their blood, so the finding does not mean vitamin D is useless for bones. It means that giving it broadly to people who are not deficient did not prevent fractures. VITAL is the biggest experiment, but it is not the only evidence. When you combine results from many experiments, those meta-analyses I mentioned, here is what the full picture looks like across the major health outcomes. On broken bones, the combined evidence is surprisingly clear. Vitamin D supplements by themselves, without calcium, do not reduce fracture risk in generally healthy adults. A 2024 analysis focused on healthy elderly people found no reduction at all. The VITAL data confirmed it. And the D-Health trial in Australia, which gave over 21,000 adults a large monthly dose of vitamin D for up to 5 years, also found no clear fracture benefit. Where there is a bone benefit is when vitamin D is paired with calcium in people who are actually at risk, especially older women with low calcium intake. In those groups, the combination reduced hip fractures by about 16%. But that was in high-risk people, not the general public. So the bone story is, vitamin D prevents bone disease caused by real deficiency. But taking extra when you are not deficient does not make your bones stronger. On dying from cancer, as I mentioned, this is one of the more promising signals in vitamin D research. The combined evidence from multiple experiments shows about a 13% lower risk of cancer death among people taking vitamin D not getting cancer, dying from it. That is interesting and worth studying further, but it is not strong enough on its own to justify high-dose supplementation or chasing a blood level of 50 or 60. On colds and respiratory infections, earlier analyses suggested vitamin D might offer some protection, especially with daily or weekly dosing, and possibly in people with very low levels. But the most recent and largest update, published in 2025 in a top medical journal, told a different story. That analysis covered 46 experiments and more than 60,000 people, and found no significant overall reduction in respiratory infections. Even when the researchers looked at specific groups, people with very low vitamin D, different age groups, different dosing schedules, they could not find a clear subgroup that benefited. So respiratory infections should not be a reason for someone already in the 30s to take more vitamin D. On heart disease, the overall picture from experiments is not encouraging. Vital found no reduction in heart attacks or strokes. D-Health found a possible small reduction, but the difference was small and could easily be due to chance. When researchers combined data from many experiments, the result was the same. Vitamin D is not a reliable way to prevent heart disease. Genetic studies, which use DNA to estimate what effect lifelong vitamin D levels might have, are mixed and sensitive to the methods used. But they generally point in the same direction. The main concern is severe deficiency, not whether someone with an adequate level should push higher. On overall death risk, the picture is complicated. Some combined analyses suggest that vitamin D modestly reduces the chance of dying from any cause, particularly in adults 75 and older, and possibly through the cancer pathway I described earlier. The 2024 Endocrine Society guideline partly relied on this signal when recommending extra vitamin D for people over 75. But the effect is small, and it mostly shows up in studies of older adults. In studies where people already had enough vitamin D, the benefit largely vanished. So the death risk picture is, there may be a modest benefit for older adults, but it is not the dramatic vitamin D saves lives story that the earlier observational data suggested. All of that evidence is why the 2024 Endocrine Society guideline sounds so different from the 2011 version. The 2024 guideline made several key changes. For healthy adults under 75 without specific risk factors, the guideline says they probably do not need more than the standard recommended daily amount, which is 600 IU for adults up to age 70 and 800 IU for adults over 70. It recommends against routine vitamin D blood testing for these people unless there is a specific medical reason. And it states plainly that experiments have not found a single blood level number that everyone should aim for to prevent disease. That is a big shift from the older test and treat to 30 or higher approach. The 2024 guideline does recommend extra supplementation, more than the standard daily amount, for 4 groups. 1. Children and teenagers aged 1 to 18. 2. Adults 75 and older, partly because of the death risk signal and the higher risk of falls and broken bones in that age group. 3. Pregnant women, based on evidence that extra vitamin D may reduce pregnancy complications like dangerously high blood pressure and preterm birth. 4. Adults with prediabetes who are at high risk of developing type 2 diabetes, based on evidence that vitamin D may slow that progression. For everyone else, healthy adults under 75, the guideline says the standard daily amount is probably enough, and routine testing is not needed. The U.S. Preventive Services Task Force agrees. Their recommendation says there is not enough evidence to support routinely testing healthy adults for low vitamin D. They are not saying deficiency does not matter. They are saying that screening everyone for it has not been shown to make people healthier. Now let's come back to our listener, and this is where her story gets really interesting. She was at 33 before she started. She took 7,000 IU every day for 3 months. Her level went to 34. 1 point. So what happened? Her body did exactly what a healthy body is supposed to do. When you are already above the deficiency floor, your body does not keep stacking vitamin D in your blood, proportionally to how much you swallow. It has a built-in throttle, it slows down conversion, It speeds up breakdown, it stores some in fat, and it lets the excess pass through. That is why studies consistently show that people who are already sufficient get much less of a bump from supplementation than people who are truly deficient. Someone at 12 who takes 2,000 IU per day might jump to 30. Someone at 33 who takes 7,000 IU per day might barely move at all. Her body is telling her, I already have what I need. So, does she need to keep taking 7,000 IU to stay at 34? No, she built her level up to 33 over time on a lower dose, and that lower dose was working. Then she jumped to 7,000 IU a day for 3 months and gained 1 point. That tells us the lower dose was already doing the job, and the extra 7,000 IU had almost no additional effect. Her body hit a ceiling. If she went back to whatever dose got her to 33 in the first place, she would very likely hold in that same range. And 33 is a good place to be. Bone health guidelines often aim for at least 30 but below 50. The 2024 Endocrine Society guideline does not endorse a universal target above 30, and no experiment has shown that pushing from 33 to 50 or 60 delivers extra health benefits. The 7,000 IU is not keeping her in the green. Her previous dose already did that. The more important question is safety. She has been taking nearly double the safe upper limit for 3 months. The highest daily dose that the National Academies consider safe for long-term use is 4,000 IU. At doses of 3,200 to 4,000 IU per day, a 2023 analysis of multiple experiments found that people were about twice as likely to develop too much calcium in their blood, a condition that can stress the kidneys. That same analysis also found small increases in falls and hospital visits, and a 3-year experiment that directly compared 400, 4,000, and 10,000 IU per day found something surprising. People taking the higher doses actually had weaker bones, lower bone density at the wrist and shin, than the people taking the lowest dose. Too much calcium in the blood showed up in 0% of the 400 IU group, 3% of the 4,000 IU group, and 9% of the 10,000 IU group. More was not better. There are situations where doses above 4,000 IU per day make medical sense. Conditions where the gut has trouble absorbing nutrients like celiac disease or inflammatory bowel disease. Weight loss surgery patients, people on certain seizure medications that speed up vitamin D breakdown, chronic kidney disease, and some cases of severe obesity. If our listener has one of these conditions, her doctor may have a good reason for the high dose. But if she is a generally healthy adult, and her level of 33 before supplementation suggests she might be, the evidence does not support continuing 7,000 IU. So the right conversation with her doctor is not, how do I get higher? It is, I was at 33 before I started. I took 7,000 IU for 3 months, and I barely moved. My body doesn't seem to need this dose. Can I step down to something standard, and should we check my calcium and kidney function to make sure the high dose hasn't caused any problems I can't feel? Here is the framework the current evidence supports. The old model was, find the perfect number, push everyone there, and assume that higher is healthier. The new model, prevent real deficiency. That means getting 600 to 800 IU per day from food and supplements for most adults, and more for those over 75, children, pregnant women, and people with prediabetes. Treat people who have a clear medical reason. If you have weak bones, absorption problems, kidney disease, a history of fractures from minor falls, or a condition that changes how your body handles vitamin D, measure, supplement, and keep an eye on it. Skip the blood test if you are a healthy, low-risk adult. A normal diet, some sun, and a basic multivitamin or low-dose supplement is enough for most people without the need for lab work. And do not assume that higher levels are automatically healthier. The evidence has not shown that pushing from 30 to 50 or 60 delivers extra benefit for the general population. And at high doses, the safety data starts pointing the other way. Vitamin D is not a lab number to optimize forever. It is a nutrient to keep adequate. The older thinking treated it like a dial, turn it higher for more health. The newer evidence makes it look more like a floor. Get above deficiency, treat specific risks, and be careful with high doses. Our listener's body just proved the point. She was already above the floor. She cranked the dial as high as it would go. And her body said, I'm good. That does not mean vitamin D is unimportant. Real deficiency causes real harm. The autoimmune findings from Vital are genuinely interesting. The cancer death signal deserves further study. And there are groups who clearly benefit from extra supplementation. But for a healthy adult who is already at 33 and barely moved after 3 months of 7,000 IU per day, the smart move is not to keep pushing. It is to step back, talk to your doctor, and let your body tell you what it already tried to. That is this week's episode. If you found this useful, hit subscribe so you don't miss the next one. And if you have a health question you want us to untangle, leave it in the comments. Until next time, stay curious, stay skeptical, and take care of yourself.